While Memorial Day commemorates those who died in service to our country, there is, of course, great concern on this holiday, indeed every day, for the veterans who live among us, especially those with serious health issues. Our own Brett Baer sat down recently with a man whose job it is to see that those needs are addressed.
Mr. Secretary, thanks for the time.
Thank you.
It's Memorial Day. Do you have a message, first of all, for the men and women of the U.S. military?
Well, this is an important time of reflection for our country. I think about all the families that today are going to be out visiting our national cemeteries. And with less than 1% of Americans now serving in our military, I think we owe those that serve a great deal of gratitude and reflect on the memory of those who have actually given their lives for our country.
You have a big job. Have things changed? Are you seeing change?
Well, I'm optimistic. I'm a doctor, so I like to put things in terms of clinical terms. We're in the intensive care unit, and we're monitoring things really closely. But I am optimistic that we're beginning to finally deal with the issues that have plagued the VA system for decades.
Have you seen wait times change?
We have. We're seeing an improvement. Our job is not done, but we now have same-day services for primary care and mental health in every one of our VAs. We've published our wait times so everybody can see where they are. We're the only system in the country that has done that, and we're working really diligently to make sure that nobody who has an urgent medical need is waiting for care.
So how did you do that? Did you do something different than Secretary McDonald was not doing?
We're doing a lot of different things. We're hiring more people. We're making sure that our leadership knows what their job is and they're focused on it. And by publishing our wait times and making them open, it's a way of actually fixing our system and making sure that people know that we're focused on the right job.
You just fired the head of the D.C. VA hospital. In late April, you fired the head of the Shreveport VA. Is it easier to fire people when you find out egregious things that are happening?
Well, it's still too hard to make sure that when our leadership loses its way, that we're able to remove them from service. So we do need legislation to help me do the job that the American people want me to do. And the House has passed a bill. We are looking forward to the Senate introducing a bill in the next few weeks so that we can get those authorities that we need.
Do you know how many people you fired?
I don't keep track of the number. I make sure that when I find a situation where somebody has really deviated from our values, that they no longer are in the VA system.
What's the biggest problem? I mean, if you were to just boil it down, what's the biggest problem in terms of services?
The biggest problem is that the VA has failed to modernize when the rest of healthcare has been actively changing and evolving. So we are hard at work at now making those decisions. The President's budget that was just given to us allows us the resources to invest in making the VA a system that we're all going to be proud of.
Yeah, taking a look at that budget, it is up $4.3 billion, roughly 5.8%, and that is seen as a plus. However, with that comes some changes that are not welcome. The American Legion is ripping the budget, saying the administration's budget would effectively lower the earnings of the most vulnerable veterans by reducing or eliminating disability payments from veterans who are most in need. This plan breaks faith with veterans. They're talking about this effort to essentially change what in essence is the unemployment payments. What about that?
Well, look, I have a great deal of respect for organizations that serve veterans like the American Legion. I take their concerns seriously. But let's remember, the budget that the President put forth is a big increase and provides more resources to the VA. What we're doing is we're also looking at our current programs and making sure that we're revising them where we think there's opportunity to shift resources to help more veterans. In the case of unemployment, this is a program that doesn't have an end to the age limit for where we pay unemployment. So we're currently paying 7,000 veterans for unemployment above the age of 80 years old. We think it's appropriate to take a look. Can we do this better so we can shift resources, not take them away, to other veterans that are in need?
Is the system overloaded with non-combat veterans?
Right now, as you know, we are providing care to every combat veteran after they leave the service, but the majority of our veterans that we serve are now in older age groups, particularly the Vietnam veterans who are coming in. The average Vietnam veteran now 67 years old. And the older that you get, unfortunately, you need more health care services, so we are dealing with an older veteran population.
It's been 2 years since Congress passed a major bill to reform the VA system. Did it work?
I think that the bill that Congress passed did work. It provided us the opportunity to get veterans who were waiting for care out into the community, and now 1/3 of the care that we deliver is outside the VA system. We do need Congress to help us in revising the system to make it work even better for veterans. If we're going to fix this system, it's going to be a partnership with the President's leadership, but a partnership with Congress.
Is part of that giving vouchers for private coverage, for private health care work?
Well, what I've said is that what we learned in this last crisis from 2014 is that the VA needs to get better, but it can't do it alone. And the system that's going to work best for veterans is an integrated system between the VA system, a strong VA system, working with the private sector.
Where do you put the number for suicides?
Well, my single clinical priority is to reduce veteran suicides. Today, unfortunately, we have 20 veterans a day who are taking their life through suicide. That's just completely unacceptable.
20 a day?
20 a day. And so of those, about 6 are getting care in the VA system, but 14 are out in the community. And I worry most about those that aren't getting the care they need. So this is something that suicide prevention is everybody's problem. We need to work with community groups, family members, veterans organizations to make sure we're getting veterans the care they need.
There are a lot of important jobs in government, Mr. Secretary, but yours may be most important, especially when we look on this Memorial Day.
Thank you very much.
Thank you very much.
Thank you.